And joining us on the broadcast this minute is Dr. MC Mishra, former director of AIIMS, joining us live now from Gurugram. Thanks very much, Doctor, for speaking with us. Let me begin by asking you to outline for our viewers the basic precautionary measures that they should undertake if they are traveling outside their house, given the kind of restrictions that have been imposed. Of course, the advisory says that non-essential travel should be avoided, but when commuting from their residence to their workplace, for example, what kind of precautions should the individuals undertake?
I think the biggest measure which we all can take and all the viewers can take is that they should not panic. That is number one. COVID-19 is a viral infection of the family of SARS and MERS, which happened in 2003 and 2012. And it is relatively milder than these two because whatever fatality rates have been shown so far in China, in Italy, in Iran, and in other countries like USA and even in India, the fatality rates are low, close to 2 to 3% in low-risk individuals, and it is higher in those who are elderly, above 60 and 70 years of age with comorbidities, that is, if they are suffering already from diabetes, hypertension, and chronic obstructive pulmonary disease, or they are immunosuppressed for some reason. So I think that is one thing which everybody can observe, that if there is a elderly people should avoid mixing up in large gatherings, not attending marriages, marriage parties, avoid local travel also. Others who go to work, if they can be allowed to work from home as far as possible, if this is IT related work, but if they have to go, they can actually go for work and just be cautious. If somebody they suspect is coughing, they can quietly tell that person to observe the coughing in the manner that it is not sending out any droplets to other individuals in the, suppose in metro or in bus or in other trains. And that is something can be done. And one measure which everybody can take, if there is a sneeze or cough, they can use their elbow like this, and they can sneeze or cough into this instead of putting their hands like this, or even if they are using any tissue paper, then it should be safely discarded immediately in a closed bin. I think that is something which everybody can do. Otherwise, healthy individuals need not to use any mask also. The mask is essential for those who have some symptoms, they are sneezing or coughing. I think that will serve much more purpose than everybody putting on a mask. And because the mask also needs to be changed, it should be cleaned. If it is a reusable mask like made of cloth, then it needs to be washed and it should be autoclaved or whatever. And otherwise, hand hygiene is the most important thing. If somebody is really looking after somebody at home, and maintain a distance from that person also. Maybe you can give the food while door is not completely open, and then take the utensils and then wash them properly with the hot water. And as you already explained, that what precautions as far as their clothing is concerned and their other the bath etc. is concerned. So I think in the home environment also distance has to be maintained. This is something which we all know, but like common flu also we know that if it happens to one person in family, it then every family member in the family catches that flu, common flu. And that is because we do not observe these measures normally. Because now since there is a lot of fear against corona infection or COVID infection, that's why we are talking about these precautions. So I would say that social distancing is one way of containing this outbreak or epidemic, and also avoid travel if it is avoidable, but naturally one has to go for your daily grocery or work. You can't avoid totally, but like we go to hospital every day, we take rounds, we go to the wards, we see the patients in outpatients, and we then take precautions as far as possible.
Right, doctor, since the symptoms of COVID-19 are so similar to the symptoms of a common flu, cough, fever, difficulty in breathing, at what point should someone who is experiencing those symptoms actually go visit a doctor and undergo a checkup so as to also not overwhelm the medical facilities?
Absolutely. I think it's a very pertinent question, and what I would say, if somebody is having, say, sore throat, irritation in the throat, somebody has some kind of cough and mild fever, which can very well be controlled with paracetamol at home, then there is no need to visit even the physician, and you can actually have consultation either through social media, using say FaceTime, using WhatsApp, a video call, and you can show yourself to that, because if unnecessarily you crowd the hospital emergencies or outpatient, there is much more risk of spreading the infection, even common flu, to others. So what I would say, unless the fever is high grade, when you are not able to control at home, that is one time that one should visit the hospital, or when somebody develops breathlessness at rest, when somebody is at home and his respiratory rate goes up, which suggests that this virus has affected the lower respiratory tract. I think that is one indication for hospitalization and monitoring by giving oxygen and maybe ventilation, non-invasive, invasive ventilation, depending on the condition of the patient. So I think milder illness, and 80% we know it's a mild illness which is self-contained. So self-quarantine, self-discipline at home would work in 80% to 90% individuals. This is only in elderly and some young people also it can happen if the viral load is higher. And because this virus, unlike common flu, which is upper respiratory tract infection, where sore throat, cough happens, this virus tends to settle down in the alveoli of the lung, where gas exchange takes place, oxygen exchange takes place. There is swelling, inflammation, swelling, and waterlogging in the part of the lung, which leads to pneumonia, and then which leads to respiratory distress. And if it is more severe, then it leads to respiratory distress syndrome, and these patients need ventilatory support. And that is where the healthcare workers take care of them with utmost care and caution, because there is always, the healthcare workers are at a very high risk of contracting this illness from these patients.
All right, Dr. MC Mishra, appreciate very much joining us on the broadcast with those perspectives and those details.